Yes, my people, I'm here again. Benjamin, the wise guy, is here to continue with some topics that are giving people sleepless nights. Let me see this here. The topic that you're going to do today is on request. It's on request. It's a topic on request. So, okay. Topic on request. Cool. Cool. Okay. Okay. Study some parts of mental health. Barbara's World. Welcome so much, Barbara. Today we are going to talk about uh, menopause. Menopause, but in terms of mental health. We're going to talk about menopause, but in terms of mental health. So, if you are coming in right now, thanks so much coming into the group right now. There is a topic. This topic, some people requested I repeat, but you see, we dealt with it in medical field. Now we want to deal with it in terms of yeah. I'm fine. I'm just getting online. Yeah, yes. Yeah. Okay. Okay. Yeah. Okay. Now, we there is a way. Let's see this one. You see, some things like menopause, most of them, they affect mental health, and we really need to understand how mental health affects a person when this person is getting aged. You see, there are some situations that you can you can live with a person thinking things have changed in life, and it is a normal way of life, transition of life from somewhere to somewhere. Transition of life is normal in every life, so we really need to know how to cope up with some situation. Menopause can have significant impact in mental health, and for many women, the emotional symptoms are just as changing as physical ones. You get it? For women, someone told me to let me post. Okay, someone is asking a question. You see that what I'm saying is, for many women, emotional symptoms are just as challenging as physical symptoms. You imagine that? Yeah? Okay. I go to activation. Yes, activation. Jamaican uncle is here. Is here. Menopause. I'm live now. Yes. Now, we have said physical symptoms can change just like emotional symptoms for women. You see, they can change, and sometimes it becomes so bad that you may find that you are undergoing some things and people are judging you, and it's not, it people are judging you wrongly. Yes. It is not good to judge as a person who is on menopause. Why? Because these are hormonal transitions, and this person is undergoing some things. Why menopause affects mental health? I want everyone to know this. There is an important point that people don't know. It is biological and it is physical. Hmm? Menopause involves fluctuating and eventually declining level of estrogen and progesterone. You get it? That is the first point. Menopause involves fluctuating and eventually declining levels of estrogen and progesterone. These hormones influence brain chemicals like serotonin. There is a mood regulator. You see, there is there is a hormone, in your brain called serotonin that gives you mood. It regulates mood when you want to be happy, when you want to be sad. And then there is dopamine helps you when you want to feel pleasured, pleasure, when you want to kiss, when you want to feel affection, when you want to be close to someone. Your brain releases that chemical called serotonin. No, dopamine. Serotonin, it regulates the mood, but dopamine gives you the pleasure, something that makes you feel better. GABA, calming effect. You see, when you are aggressive, you are so aggressive, and then now you want to calm, you do something to make yourself calm, or you keep quiet. Your brain, now men should also get involved in supporting their partners through menopause. Very important. Barbara's world, yes, we talked about it in our talk last time. When we were talking about menopause, we talked about how men can support. And some do sometimes even men undergo the same they undergo the same transition of hormones, and they are undergoing sometimes menopause, and you don't know. I can just say transition of hormones because they reach somewhere and they be confused on what to do. And then you start saying midlife crisis. It's not midlife crisis. Some hormones are transitioning. So it's Barbara is saying the truth. Men should be involved to taking care of their partners through menopause. You get it? So when you are aggressive, there are very important three important hormones. One is serotonin, two is dopamine, and three is GABA. So mood regulator is serotonin. Dopamine gives you pleasure. When it is released from your brain, you want to feel something good happening to you. And GABA, when you are aggressive and you want to shout, you want to do something, and it is released, you calm down. You get it? When hormone levels shift, mood and emotional stability can shift too. You get it? There is a balance of these hormones in your body that can it's needed for you to be normal. But in menopause involves fluctuating and eventually declining level of estrogen and progesterone. And if you have a declining levels of estrogen and progesterone, this is where we say now fertility has started to go away. You get it? Because they are the main drivers of fertility in a person. You check it out. Very important. Common mental health symptoms, in a person who has during premenopausal and menopause, women may experience irritability, mood changes, mood swings, because now here we have something called GABA and dopamine that are changing and changing. Irritability, mood swings, mood changes, increase in sensitivity. If you tell someone something, this person becomes aggressive every immediately. Sensitivity, anger, and frustrations, because now serotonin sometimes is not released from your brain. Progesterone and the activating factors are not there. So you find that it is struggle of hormones, and you become irritable, anxiety. Those people that at times this person new onset anxiety, yeah, even without previous history. Panic attacks. Have you ever any person who is listening, have you ever had a panic attack just from nowhere? A panic attack just from uh, let me see. Barbara is saying, unfortunately, I'm going through it alone. Ah, Barbara, come on, alone how? And I'm here. We are here. When we meet online, we smile and we feel everything is going okay. You are not alone, Barbara. You have many friends. Now stop joking now. That you see, when we are coming, oh, Dorothy K. Hey, Dorothy, welcome to the platform. Greetings, Doctor. Yeah. My friends are here. Mercy Grace. Mercy Grace. Imagine Barbara is telling me, unfortunately, she's undergoing through it alone. No, that is why we have formed a community of talking to each other and helping each other, Barbara. Now you know you are not alone. You see, you are with me here, you are with Mercy, you are with Jamaican uncle here. Eh? That is very nice. That is so nice. Eh? Yes. Now we continue and say, hi Dorothy. We are here to support. We are here to support. And we continue and say that. The onset, or I think I should do pathophysiology of menopause. I want people to understand that menopause is not just an age. Eh? I want to repeat something that we discussed last time so that people can understand what menopause is. You get it? Miriam Mumbwa, always smiling and lovely lady. Miriam supports everyone open heartedly. Thank you, Miriam. Now, I want everyone to understand. I want to repeat about menopause, how menopause comes, so that when we are discussing about the effects, we are understanding where it comes from. Now, menopause is a physiological event characterized by permanent cessation of menstruation due to loss of ovarian follicle activity. Ovarian follicle activity, the pathophysiology, how it comes revolves around ovarian aging and hormonal changes. And you see, your ovary, they are stimulated from the brain. There is something called follicle stimulating hormone and luteinizing hormone. So those ones are the ones which are released, and then they go and tell the follicle, now it's time to release oxytocin. Now it's time to release to suppress oxytocin. Now bring progesterone. That is the levels how they go. Now, ovarian follicle depletion, the ovaries, the follicle. I Someone told me I know how to draw. Let me draw. Let me draw another picture here. Like I'm drawing an ovary. I'm drawing a uterus. I'm drawing a uterus. Just be patient. I draw a uterus here. I'm drawing a uterus. A uterus. I'm drawing a uterus. Drawing a uterus. Now, look at this. This is a woman's uterus. And then we have a vaginal tract here. We have a vaginal tract here. This one. So, the follicles are here. Here. I here. The follicles are here. These are the follicles. So the follicles are the ones that are stimulated to control the hormones. Women are born with a finite number of ovarian follicles. You get it? With age, as you jump from 40s, now we are going to 50s, they start withering like a flower. You see, they are good flowers. Women are flowers, my friend. Women are flowers. J. Kingray, welcome to the platform. Welcome so much, and let's learn. You see, they look like flowers. Look, this is a very good flower. This is the uterus, the womb, and then you can see here we have the follicles. This side we have the follicles. They look like good flowers, eh? Like flowers that, just imagine flowers that are ready to give to the to bring life to the earth. And then as you age, they start withering. They start withering. Hmm? With age, follicles undergo atresia. By menopause, the number of functioning follicles fall below a critical level. They fall below a critical level. Results is those follicles, they give estrogen. They give estrogen and inhibin production. Yeah. So they, if you don't have the follicles that are active, eh, what goes down? Estrogen goes down. Estrogen goes down. And when estrogen goes down, what happens? Now, let's check the hormones. We have the main point as a woman. You see how we have started. As a woman ages, please, let's continue as we do. Let's like the video and usher in someone where you are. Tell that person we are here. We are learning about mental health and menopause. Now, we have started in this way. As a woman ages, the follicles, which are the flowers that bring the life, they start to degenerate. And when they start to degenerate, what happens is this: they start to do what? This stage makes some women behave like kids. It's true, it makes some women behave like kids. As they age, what happens? It makes some hormones like, oh, Gabi, I saw you with what I like, omena is I don't know omena in English. That stew was, it was killing my stomach. I felt hungry. Now, as those follicles wither, they reduce estrogen and a hormone called inhibin. So when they reduce estrogen and inhibin, there are some protocols that the body undergoes. Yes, there are some protocols that the body undergoes, that in sometimes you start having some problems. You start having some problems. In a way, you do what? You function. Second, we have started by ovarian follicle depletion and then hormonal changes. Hormonal changes, estrogen itself, eh? Especially estradiol, there is a hormone called estrogen. If the follicles are withering, estrogen will go down. It leads to vasomotor instability. So the follicles are withering, eh? The nerves are suffering, and then because estrogen is going down, what do you get? Now you start getting hot flashes. You start getting, that is what excites the hot flashes. This stage makes people talk alone. Dorothy K. Dorothy K81 says this stage makes people talk alone. Yes, if you've not liked my live, man, let's like and discuss. Yes. Now, Dorothy, today you'll know why it makes people talk alone. Now, when the vasomotor instability, when the flowers, the follicles has made the estrogen to go down, hot flashes come because of nerves, muscles. You start having hot flashes. Your estrogen is going down. Vaginal atrophy. You get the vagina now starts to be smaller. You get it? And when it's coming to be smaller, atrophy, the muscles, you have nerve related complications, and that's where you start having neuropathies. Neuropathies come with the hot flashes. Bone resorption, eh? Also osteoporosis. This is a place whereby even your thyroid itself will start having a problem, because the thyroid is divided into the frontal and the back one, which is the parathyroid, which controls the calcium levels. And you find that the calcium levels are depleted now, because the parathyroid behind it is not able to to control. And then there is a hormone called inhibin. B. Normal suppresses follicle stimulating hormone. It declines cause loss of negative feedback. If there is no estrogen, the inhibin will not tell follicle stimulating hormone, stop, stop what you are doing. You get it? Now you will have it a lot of hormones that are just coming out of the brain and doing whatever they have. There is another hormone called gonadotrophin. Those hormones are follicle stimulating hormone and lutein from the brain. Due to reduced estrogen and inhibin, they rise significantly, and when they rise, eh, they suppress some issues in your body. They stop some issues in your body. The ovaries become less responsive to hormones because if FSH and luteinizing hormone are high, your ovaries will not respond. You get it? And if your ovaries are not responding, please, if your ovaries are not responding, what will happen? An ovulation. Cycles become irregular. Abs and spies. Hello, Dr. Benjamin and everyone. Hi, abs and spies. You see, cycles become irregular before menopause. That is called premenopausal. You get it? Remember, it started by this. This is your uterus. It started by this one. These flowers withering, withering because of age. As you age, they wither. Please, if you've not liked the topic, please like it as we continue. This is how menopause comes. Simply, the flowers have the flowers, as you age, they lose their strength. Hormones like estrogen, they are depleted. You don't, if they wither, you don't produce estrogen. Then there is a hormone called inhibin. Inhibin, it suppresses a hormone in your brain called follicle stimulating hormone and luteinizing hormone, which controls the menstrual cycle. Now, because its inhibin is not there, it releases a lot of follicle stimulating hormone and luteinizing hormone. And then what happens before menopause? You start having an ovulation. Cycles become irregular before menopause. Failure of ovulation, no corpus luteum, and then progesterone goes down. You get it? Endocrine environment after menopause. Ovaries produce minimal estrogen, and you get it? Small amount of estrogen that cannot help you. Peripheral conversion of androgen in the adipose tissues rise. Androgens are like steroids that your body produce. They persist. Then we have some organs that are targeted. Some organs are targeted like endometrial atrophy, thinning epithelium, and vagina. The vagina thins and the epithelium, the layers of the vagina thins and it becomes dry. Hot flashes on another level. Hot flashes now, Dorothy K, they are coming because of the estrogen is not produced. When these follicles starts to wither, when these follicles starts to wither, and you know they produce estrogen, when they start to wither, what happens is the nerves are affected, and that's where you start having hot flashes because of the nerves that are affected. Now your breast glandular atrophy becomes small, your breast. Bones increase in resorption. Oh, you get it? Cardiovascular system increase risk to loss of estrogen, the cardiovascular system. Now, we continue with the topic. I've explained how. If you have not captured that, please tell me to repeat. I know now everyone knows where menopause starts from. We are growing in number. Please, let's give the likes as we go. Give the likes. Now, in simple steps, this is what happens, how menopause comes. In your uterus, the follicle starts to wither. When a plant has given more flowers, the part of giving flowers withers, and then it produces what? Estrogen. It produces estrogen. Those follicles produces estrogen and something called inhibin. So if estrogen is less than inhibin, in your brain there is something called follicle stimulating hormone and luteinizing hormone. They are released and they become so overwhelming in your body, and the control goes overweight. So when they are there, now your menstrual cycle becomes irregular. That's why we start by menstrual cycles that are irregular, then we go to menopause. Now we continue and say, we know now where menopause starts, and it's Gabriel Mao. Thanks for sharing. Where menopause starts, it starts from the uterus, where the follicles starts to wither because of age. It is a physiological nature. Now we continue, and we have talked about three chemicals that are serotonin, dopamine, and GABA. These three chemicals, serotonin is mood regulator, dopamine gives you pleasure. That's why some women, when they are undergoing menopause, they don't feel like making love, they don't feel their partners, they don't feel even there is need to be close to their partners. Why? Because the dopamine that is supposed to be released from your brain is not there, and dopamine is the hormone that gives you pleasure, feelings. GABA gives you calming effect. When it is not there, when your brain cannot release enough GABA, you will be irritable, you will always shout to people around, you will always, you see, serotonin, mood regulator. Because now the follicle stimulating hormone and luteinizing hormone, they are overwhelming and overclouding others in the system. You see, it becomes a problem. It becomes a problem. Why? Because there is no mood regulator. And you see, this thing that started from the follicles of your uterus. Hmm? It's just started from the follicle of your uterus, and it stopped inhibin from being produced. Now it's affecting even the brain. Barbara, don't worry, man. Don't worry, our lady. We are here for you. Don't struggle with it alone. Come online, shout to us, and let us shout back to you. And then after we shout back to you, dopamine will come through, GABA will come through, and your brain will release GABA, and then you will feel the calming effect. You get it? Very important and very nice. Now, we continue and with common mental health symptoms. Let's go to symptoms. And as we go to symptoms, you already know how these symptoms come, because I've explained about the how it comes. You get it? I've explained how it comes. Common mental health symptoms are like mood changes. Margaret in Norway. Margaret in Norway amefika mbio sana. Hey, Margaret, I missed you from yesterday. Thank you for coming. Thank you. Nimefika means I'm already arrived. So Maggie has arrived. Now, during menopause and perimenopause, menopause, women may experience mood changes like irritability, mood swings, increased sensitivity, anger, and frustrations. And why? Because the hormones that I've talked about, serotonin, GABA, and DOPA. If you have a woman, I was about to come for you. Dorothy, Barbara was about to come for you. Yes, if you have a woman and you are a man, and this woman is not into sexual pleasures, she loves you like a man, but she's not into it. Go find GABA, inject your woman, let your woman arise again. You see, if your woman is irritable every time, shouting, shouting. When you tell this woman something small, she's shouting every time. Just go find a hormone called serotonin. It will stabilize her. It will stabilize her moods. We have talked about it. Those hormones, calming effect of GABA. Find GABA. Give your woman GABA. Don't start saying this woman is. There are some women that they love you, but the pleasure thing is not in them. It has started fading away. Just know it is transition. Find what can, and you see these things break marriages and relationships at times. Now, anxiety, new onset anxiety, even without previous install. Panic attacks always, racing thoughts, healthy health anxiety. Every time thinking I might be having cancer. Have you ever met someone who is always thinking I might be having cancers? Or someone who is always thinking that my stomach has a problem? I want to go and do an X-ray. I want to go and do laboratory works. I want to visit a hospital. I be checked. I think I'm not okay. These are the ages: anxiety, health anxiety, and then there is depression. Depression, low mood, loss of interest, fatigue. Hmm? Hmm? eh? Feelings of hopelessness. You get it? This is where a person feels is hopeless because all the moods are, and you've seen where we started from the follicles. We started from the follicles here, follicles withering, follicles withering of your uterus, follicles withering. Yeah? And then there is something called brain fog, and someone has just said it. Lucas, ngoja nitakupigia. There is just someone has said about brain fog. Someone has mentioned forgetfulness. Dorothy has mentioned forgetfulness. Yes, difficulty in concentrating, word finding problems. You want to say something and then it gets away. You know it, but you are trying. Before you say, you remember the word, you have taken time. Mental fatigue. You are tired mentally. You get it? These are the problems that we deal with at this chapter of age, forgetfulness. Because now dopa, serotonin, and GABA are imbalanced. And you know, they started from where? They started from your uterus, your follicles withering, and oxytocin and inhibin going, estrogen going away. And then it infiltrated. Follicle stimulating hormone and luteinizing hormone in your brain became so much until it started behaving in a way some hormones cannot be really released. You start forgetting, you start having difficulty in concentration, sleep disturbances, often linked to night sweats, insomnia, early waking. You wake up early in the morning. You see, very, very important to know that you have no problem. It is nature, and this nature is the one which is making you feel that way. You get it? The risky period of menopause is not even the menopause itself. The perimenopausal stage is very complicated because this is now the transition. Is often when symptoms are stronger. Now, if you have any question concerning menopause, let's talk about it now. Let's talk about it now because I'm saying, you see, the premenopausal stage is the most important stage because this is where the hormones are fluctuating right, left, and center. And you see, who is vulnerable to this condition of menopause? Who is vulnerable? Risk increases if you have a history of depression or anxiety. There are some people have a risk of they have a history of depression. and they are always anxious, and you are heading to, some of the people even lose life because of having this problem, and they are heading to depression. These are the people at risk and vulnerable. Those that experience postpartum depression. Postpartum depression is when you have given birth and then you get into depression. The day you will start getting to menopause, you will need proper care. You get it? High, they have high stressing levels. Those people who are always stressed, perfectionists. Perfectionists are very good people, but when it comes to handling some issues like depression, it is bad. So these people that are perfectionists, hmm, personality group A, go to my mental health playlist, find personality, types of personality group A. You have a problem when it comes to menopause. And those people who have major life stressors like aging parents, teens, and career changes. Hmm? How can we have it easy during peri, and we will discuss, we will manage it, Mercy Grace. Today we are just introducing so that if we have time we can manage. Hmm? So those are the people who are at risk of this. But let's see, what can help, what can help when it comes to these problems that we are facing. What can help when it comes to peri and menopause? Because peri is the most important part before you stabilize to menopause. Hmm? You see, regular exercise is important. Regular exercise is important, especially strength training plus walking. Hmm? Consistent sleep routine is very important. Yeah? If you go to bed at 8, go to 8, sleep 8 hours or 6 hours, have the consistency in sleeping. It helps mood. Limit alcohol. Those people that take alcohol, limit alcohol. Alcohol may be your major hormone imbalance tool, and you are in menopause. So manage alcoholism. Mindfulness or stress reduction practices like dancing. I love dancing, like going to the gym for aerobics, like some women like uh, sewing. We have a friend here, Betty, who sews uniforms. Very important. Those are things that help a person to manage the stress well. But there are some medical options when you see this is so much. You can do hormonal replacement therapy, heart, and like using antidepressants like SSRIs. They are called serotonin inhibitors. Those ones, what they do, they make the brain to slow on reacting. Hmm? So they slow something called serotonin. Serotonin, rich, high dog, present and following. Thanks, Rich. So, welcome. These hormones, they stop things like serotonin. So that serotonin, when it is changing, we have said serotonin is mood stabilized. Sometimes when it comes so much in your brain, you become irritable. So if you use something like fluoxetine, it inhibits it and it becomes the amount that is needed. Hmm? Therapy sessions are very needed. Okay? And then we have uh, therapy can help with identify shifts in midlife, body changes. I'm just introducing. We will deal on another video, mental health during, how to deal with mental health problems during menopause. We will deal with it. This one is just an introduction. Emptiness transition, and then we have relationship changes. Now, those ones are an overview of how to deal with it. Today, I don't have much time, but I've just introduced. So I think it's 39. Can I give like 10 minutes? 10 minutes. Anyone who has a question for me, please. Anyone who will be having a question concerning. But for management, it is coming. We will deal with management of mental health crisis when it comes to mental health. I'm getting back to my work out routine gradually. Thanks to Margaret in Norway. Yes, Margaret, you see, Barbara, you are saying that you are alone. You are not alone. You've seen Margaret in Norway has helped you to go back to routine. So it is very important to the community that we are in, and especially the people that we are in the group. Sometimes when you feel you have something and you have captured someone has a way to help you, chat to that person privately. Hmm? If it is a matter of bringing it public, chat to one of the admins. Tell this admin that I want to talk about this. Can I post it? You get it. And then you get help. Thanks for Margaret in Norway. Very important. Dr. Ben, my question is not related to menopause. Weight gain after COVID due to spike protein. Any advice how to reverse or control it? Yes, weight gain after COVID. After COVID. Now, that is a very nice question. That is Herbs and Spice. Herbs and Spice has asked this. After COVID, she had I hope it's you. Is it you we are talking about? Weight gain after COVID. Hmm? Weight gain after COVID. First of all, we need to know what made the weight to come after you've become sick. Hmm? What made the weight to come? I've introduced the topic on menopause and about mental health. I've said what happens to your brain mentally. So tomorrow I'll deal with management of mental health crisis when it comes to mental health or to menopause. Tomorrow I'll deal with it. Oh yes, it's you. Now, uh, this is herbs and spice. When you were having COVID, COVID is a viral thing. I guess sedentary lifestyle brought about weight gain, my opinion. Yeah, Ritsu, it's not sedentary lifestyle. It's not. This is a person who was sick of COVID, and then after COVID, it brought about weight gain. So this is what makes some of men marry another woman because the reactions become slow. Oh yeah, Dorothy, very important. Those men that don't reason and they don't know what is happening, men that don't know how to support their women, you should share these videos to them. Now, this is herbs and spice. When you are having a viral infection, especially on your chest, on your chest, the drugs that you are exposed to, the drugs that you are exposed to. Oh my bad. I guess I hadn't had the question. Sorry. The Rich, the question is, let me repeat the question. Dr. Ben, my question is not related to menopause. Weight gain after COVID due to spike protein and advise how to reverse or control it. Yes. When you are having COVID, you are having a viral infection. The main I was bedbound around 7 months and contracting COVID, and now mobility issues. Yes, because of weight gain. Let me explain this first. What the target therapy when you have a viral infection is to reduce inflammation around your airway. And the drugs that are used to reduce inflammation, most of them are steroids. And steroids act on the brain hypothalamus, making you feel hungrier than usual. So you eat more. You get it? Then, second, you get fluid retention. Because of the steroids, they cause sodium and water retention, leading to, when you are using steroids, you accumulate more sodium. You check it out, you get puffy face, swelling in the legs, and rapid weight increase. This is what happens. And then we are still giving you, we want to save life, because when you are using steroids, they relax the airway and then the chest, you breathe better. And you know, still the complication of airway, the complication of airway starts from the complication of the airway starts from your mouth to your lungs. So steroids relaxes and open it away up. So when you're using these steroids, because when you were having COVID, you used a lot of dexamethasone and prednisolone. And I'm very sure at times when you are sick, you still use prednisone. Prednisone is the blue tablet that is a steroid, or hydrocortisone. So when you are using them so much, steroids change how fat is stored, leading to they change how fat is stored, and it deposits more fat on your skin, on your face, on your neck. You get it? Having buffalo hump, your neck becomes big, and the abdomen, central obesity, you have a big, because you are using steroids and they are converting fats and storing them on the skin where they can dry. You get it? This pattern is typically called Cushing syndrome. Cushing syndrome is an overflow of steroid. Hmm? Increased fat storage, steroid increase blood glucose, insulin levels, which promotes fat accumulation. You get it? Now, muscle breakdown. They cause protein breakdown. You have a lot of fats with minimal muscles. You get it? Yes, that is it. Have it mainly around my belly, face, and neck. Yes, because you used a lot of steroid at that time. And for the worst, they used monoclonal antibodies like ifiximab. Those ones. Mm? Body looks heavier even without huge fat. And then reduced metabolism and activity. Always you feel fatigued and weak. You see where we started? You are sick, we were saving your life by steroids, but the steroids have brought about some issues. Now, this is how you can manage it. For those that have undergone this and they undergone the COVID, and they have gone through all this. Yes, that is it, mainly around my first. Yes. You see, I'm just talking about how things happen and someone is attesting. So if you have weight secondary to steroid use, when you have, how can I get GABA? There, yes, you can get it on prescription by a doctor or go to a pharmacy. They are some drugs you can get with prescription, but you can ask your pharmacist where you are if you can get it without prescription. It depends with the country. Now, reduce salt intake. If you want to be well, limited sugary food, reduce fat gain. Limited sugary foods, eat high protein food, protein for muscles, because you need more creatinine to build the muscles. So reduce sugary foods and carbohydrates, reduce salt to prevent fluid retention, increase vegetables and fiber. Now, herbs and spices, you hear that? You reduce salt, you limited carbohydrates, and increase vegetables and fibers. Exercise. Always when you're starting, start exercise with light to moderate. Yes, yes, yes. That is very important. Some people do keto diet. They only take proteins. They only, and they forget about carbohydrates forever until they get where they want. Resistance training, important to prevent muscle loss. So that is how you can help yourself. And when you are sick, if there is an option of not using steroids again, it will help you It will help you. Yes, I'm doing keto. Keto will help you herbs and spice. Go to the gym, do exercise. You get it? That is very important. And then there are some medicines like Oristats, those ones that help to reduce weight. You the doctors know exercise is the area which I'm struggling because of risk of falling. Yes, don't overdo it. Go to a gym that a person who is there, who is the trainer, knows what he's doing. Don't just go to any gym. Switch to alternate day therapy. It is very important when you have alternate day therapy. Use lowest effective dose. Very important. Gradual taper. Hmm? Monitor your weight changes, the swellings. Always do blood pressure and blood sugar. Anything that has come because of steroid use can always be reversed. If you do keto diet and you reduce your salt intake, hydrotherapy is important. Yes, that one is good. That one is good. If you reduce keto diet and stop taking sodium foods, you will be better. Although the redistribution may take months, but you will go back to where you are. For improvement of muscle strength, that one you have to work out and do some power therapy and so. So that is it. I've been answering herbs and spice. I think I've answered it, and we know where the problem started. Herbs and spice. Now you know where the problem started. If there is anyone here who is sick, always with chest complications, and uh, uh, and you've been having welcome herbs and space, and you've been having struggles with weight, now you know where there's a problem start. You stop taking steroids, especially men. Steroids are problems when it comes to overgrowth of tissues, and you know men have prostates. When you take a lot of steroids, your prostate will swell and then you will lose the energy down there. So please, let's stop. Let's stop the idea of any simple cough, any flu that is minimal. You are rushing to take strong steroids like prednisone and the so-called. You get it? Mhm. You get it. It's very important not to go that way. We have talked about menopause and how it starts with when it comes to mental health. Now we continue tomorrow and we sort issues of mental health in relation to menopause. Thank you so much for those who have been online. Let's continue supporting Gabriel wherever he is. Wherever he is, I'm always open. When you have a question, if you leave a question on my platform anytime, if you leave a question on my platform anytime, I will reach out to you and I will answer you according to the way it's supposed to be answered, or I will do something wherever you are and give you guidance on what to do. For those who have tuned in, continue supporting me and have a blessed day. Bye bye. We meet tomorrow, but remember the group, we are still following Gabriel. Let's give Gabriel hours, let's give Gabriel time. Bye bye. See you tomorrow, everyone. Bye.